a bit surreal. I had a lot of emotions. I think you guys know I'm a passionate person, and the build up to this event, a bunch of feelings I didn't expect came flooding through, and I'd like to share a few of them to set the tone for today's amazing content. First is gratitude, and I started to cry last night when I was thinking about this. This time 10 years ago, I was grieving the loss of my mother from a stroke that was the front end of brain cancer. I spent a lot of time in hospitals and put a lot of thought into this. And it was a very emotional time. And just prior to us learning that she was going to die, we went into Fort Meade. We warned a bunch of people that we were very, very worried about increased connectivity in cyber physical systems could affect public safety, human life, economic, national security. Nobody was ready to hear it yet. They kind of agreed with us, but said people will have to die first before we're going to see any real change or political will. And I said to my teammates from that day, the cavalry isn't coming. No one's going to fix this for us. It was very depressing. And yet during her funeral, I realized that if something's missing in the world, maybe we should put it there. And I asked a bunch of hackers at DEF CON, on August 1st will be our 10-year birthday, what are we willing and able to do? Would be a helping hand, a voice of reason? Would we use empathy? Can we inform, inspire, and influence? Can we find teammates in the government that have bravery? And we did. We found Dr. Suzanne Schwartz. We found Jessica Wilkerson, House Energy and Commerce. We found people across the federal government internationally that shared our concerns and were willing to get outside their comfort zone and do important things. So I'm incredibly grateful for the partnership and teamwork over the last 10 years. And you're going to meet some of our newer teammates today as well. But there's a bunch of us that understand the stakes, the growing stakes, and we want to make sure that we don't miss this moment. I also felt a sense of urgency. While we're starting to get political will and recognition, we are behind. We've had some bold steps. We need more bold steps. And I'm continuing to hear people pounding their hands and their fist on the desk saying, we're doing the best we can. We've got it. We're doing good enough. We don't have the money. We got best practices. And it is frustrating. I think people who've known me for a while know I'm a happy warrior, and I try to find common ground and common purpose. And we're struggling to find that right now. But today, in this room, we have quite a few warriors that want to lean in and push harder and know we can be better. So really what I want to frame today on is we have a tale of two healthcares. There's really two camps forming. There are those who believe that we are doing the best we can, and there are those who know we are not. Among that second camp are the people in this room, our Senator Warner, our Robin Kelly from Illinois, Representative Robin Kelly, the White House, bipartisan, bicameral, political will growing in Congress, but a brief history of time. While we started Diamond Cavalry about 10 years ago and built trust with Suzanne shortly thereafter at FDA, some of that trust got me on a congressional task force for healthcare and cybersecurity. I'm not going to go through all that, but we said healthcare is in critical condition. This was published in June of 2017, really Mother's Day weekend of May of 2017, as WannaCry took out 40% of the UK's hospital healthcare delivery. All the hospitals said, we sort of agree with you, Josh, 85% of which didn't have a single cybersecurity person on staff. I actually think the numbers are worse today, but we're not even measuring it. We don't have an accurate census. But what they told me is, if you gave us more money, we would hire more nurses, we would buy more equipment. We don't have money for cybersecurity, we cannot afford it. And it's even more true today under financial constraints. We have to have empathy for their financial constraints, their staffing problems. So what we did as hackers, we said, okay, if you're not gonna spend my money until people die, we'll do what any good hackers do, we'll start killing people. So Dr. Christian Mapp, Dr. Jeff Tully, Beau, and I put together the first CyberMed Summit to kill people in ER hacking simulations. To show that we're not ready for this, to create a visceral, palpable experience. Now, as I started to run the CISICO task force, I got called into public service as the pandemic was declared, and we had to protect the nation's hospitals and healthcare delivery from CISA in collaboration with other parts of the federal government. It was daunting. We lost a lot of people unnecessarily. We had a lot of supply chain disruptions. We had a lot of ransom attacks. We also had to protect the vaccine supply chains. And as we studied this, I want to proffer a model that is sincerely and deeply believed by the medical community. And I want to enrich it and enhance it a little bit as we head into today. So most hospital professionals will tell you the way we keep people alive in the city or town that your family lives in is we have carrying capacity. And that's the 3 S's: space, supplies, and staff. And that's where we spend our money: space, supplies, and staff. Having 100 beds does not mean you have 100 beds capacity if you only have 80 staffed beds. And it's not 80 if you only have supplies for 60 staffed beds. So it is the coefficient of these 3. But let's enrich and enhance that model, because what we saw during the pandemic is record strains on each of these that sometimes cascaded to the others. And it dramatically diminished our carrying capacity. At the 1 year mark of the pandemic, in spite of COVID deaths, on top of COVID deaths, we had 150,000 excess deaths as tracked by the CDC. These are above and beyond expected averages by state, by condition, by month. And I was unsurprised after learning so much from Dr. Christian Meff and Jeff Tully and others that the conditions were the time-sensitive conditions, heart, brain, pulmonary, where minutes, hours, or days can be the difference between life and death. Or to quote Christian, where minutes or hours can be the difference if you walk again, if you talk again, if you're breathing. So it's not just keeping people alive, but can we prioritize and fortify the time-sensitive conditions and the systems that support them? And the other way that this model was incomplete is medical technology. A neonatal intensive care unit nurse could handle X patients in 1990 safely, but armed with modern technology, they can handle 2X, 3X, 4X, or 5X that number from a remote monitoring station safely. So if medical technology is a force multiplier of our staff, then the unavailability of that technology is a force divider, and it drops us down to 1990 patient to nurse ratios, and patient care suffers. So the month-plus multi-state ransom attacks have absolutely had a human toll. Now this is similar, this is not the child, but as we saw on October 1st of 2021, the first lawsuit for a named victim of a ransom attack in Alabama for 2019. A complicated birth without the aid of many of these numerous technologies that assist in neonatal intensive care units or complicated births. And while the baby was born, it subsequently died. And this is now going through the courts as potentially the first named victim. On the very same day, our CISA COVID task force published the first statistical analysis of loss of life. We were armed with the idea that we could trace and correlate ICU strain to excess deaths 2, 4, and 6 weeks later. You should read the data science we published with CDC, but we applied it to say, if hospital strain, irrespective of cause, can lead to those counts of excess death for time-sensitive conditions like heart, brain, and pulmonary, where 4.4 minutes is enough to kill you for heart, 1 to 3 to 4 hours for stroke, what can 4 weeks of downtime do for the state of Vermont? So we published in our analysis that ransoms can strain a hospital sufficient to lead to excess deaths in that county or that city. So we're in a new place now. And when this is no longer just about patient privacy, I love my privacy. I'd like to be alive to enjoy it. When this can now have degraded or delayed patient outcomes and even increased mortality rates, we're in a new place. And that new place galvanizes political will. We need to think about the bottom of Maslow's hierarchy needs. We cannot have insecurity in the food, the water, the shelter, the safety. And the most time sensitive of all of those is provide medical care, which has deep dependencies on water, electricity, and transportation. And with each flu season, we lost 6 figures of Americans to these excess deaths on top of COVID from time-sensitive delays. And with each wave of the pandemic, we're further cutting into our precious workforce in healthcare. We need to have a sense of urgency. So I was asked to testify to the Senate in May, Senate Health Committee, where they were looking for their political will. Are we or aren't we going to pass the Patch Act? I think the first time we discussed things in the Patch Act was 9 years prior with Jessica Wilkerson in January of 2014 as a young staffer in House Energy and Commerce. And despite significant pushback from the private sector who did not want this regulation, Patch Act is law of the land, and everybody in this room helped. So please take the gratitude and the win. We now have minimum hygiene standards coming through Suzanne, and she's going to speak about that later. The White House is dead serious about this too. They say free market forces only take you so far. There's a time and a place to use government power. That time is now. We will use a light touch, but no lighter than is required to do our job to protect the public. And they are willing to take much more muscular posture, including the introduction of software liability in Pillar 3. Mark Warner, who's going to give us an address, and his team will be here today, gets it. Patient safety. Cybersecurity is patient safety. This is not a privacy, confidentiality records thing. Robin Kelly will be speaking with us in a moment and is also introducing bold legislation to help fill this void. So again, we are on fire. We will be ransomed for the next 10 years. And much like 9/11 showed us that hijackers can get on planes and can turn them into missiles, we did not get rid of all of our planes. So what are the steel reinforced cockpit doors that we can use to ensure that even a ransomed hospital can still safely operate their time sensitive conditions like heart and brain treatment, Can we make sure that rural and geographically isolated hospitals who cannot safely do an ambulance diversion to the next proximal alternative care, if the next proximal alternative care is hours away, it could be the difference between life and death. Can we prioritize the geographically isolated where there is no proximal alternative during a ransomware? Our best practices that we're so proud of building, they're a great starting point. But we need a yes and, because they aren't best anymore. They were predicated on a pre-patient safety era. Several of them will work, some of them will not. So good enough isn't, it's gonna take courage. And the last blitz of courage here is Semmelweis said we should probably wash our hands between going from the morgue to delivering babies, because pregnant mothers die during childbirth. It's just what happens. We can't save them all. And it took 100 years for people to listen to him, and he became the patron saint of motherhood because mortality rates improved significantly when we understood the importance of hygiene and washing our hands. This guy would not tolerate a 95% mortality rate for childhood leukemia. 5% of children who got leukemia survive. 5%. It's now 95% survival rate because this guy would not accept that we're doing the best we can. Ruben Pasternak reminds me the quality movement dramatically improved patient outcomes. We are going to lead the next dramatic improvement of saving lives because we are not accepting the status quo. So, in honor of Suzanne and her favorite musical, which I've finally seen, History Has Its Eyes on Us, I'm not throwing away my shot, and neither should you. So are we doing the best we can? Are you in camp status quo or hell no? All right, we've assembled a bunch of bold leaders that understand this moment, and we're going to force creative thinking. We're going to force critical thinking. We're going to use empathy to meet people where they are. But we have a small political will window that is growing, but it is not infinite. So let's do the right thing.